Welcome to our monthly webinar hosted by the Institute of Public Health. I am Dr. Balázs Adam, serving as a faculty at IPH. This webinar is part of the global campaign, This is Public Health. Our goal is to shed light on various important public health issues. I am pleased to inform you that this webinar has been accredited by the UAEU as 1CME. We are honored to have affiliations with OSFER, the Association of Schools of Public Health in the European region, and the IFA, Emirates Public Health Association. Let's discuss the housekeeping. During the webinar, you will have the opportunity to ask questions. To do so, simply click on the Q&A option located at the bottom middle of your screen. Feel free to submit your questions throughout the presentation, and we will address them at the end. Please do not use the chat box for this purpose. Please note that this webinar is being recorded, and the recording will be uploaded to our YouTube channel, Institute of Public Health, CMHS. You can access the recordings of all our previous webinars hosted by the IPH on this channel. Upon conclusion of the webinar, we will provide a link in the chat for you to evaluate the session. Your feedback is essential, and by completing the evaluation, you will receive your certificate of participation. Now, it gives me great pleasure to introduce the speaker of today's webinar, Dr. Eleni Fthenou. Dr. Eleni Fthenou received her PhD from the Medical School of the University of Crete, Greece, in 2007, and before that her BSc in Genetics Immunology from the University of Aberdeen in the UK in 2003. She has worked at the Department of Health Research Governance at the Ministry of Public Health in Qatar, where she was highly involved in the development of Qatar's national policies, regulations, and guidelines of health research for safe and innovative research ecosystems in the country. She has also worked as a scientist at the Institute for Global Health and Center for Research in Environmental Epidemiology in Barcelona, Spain, focusing her research on molecular epidemiology and the exposome. She was a manager of the Clinical Nutrition and Epidemiology of Diseases Laboratory at the University of Greece, designing and developing the biobank for the first mother-child cohort, the RIA study in Greece. Currently, she holds the position of a scientist at Qatar Biobank for medical research, focusing on the science of biobanking, committed to the promotion of research in precision health, environmental epidemiology, and the translation of research findings into policy. She has participated in different grants from Qatar National Research Priorities, as well as in European and US projects, such as the New Generis and others. She is the lead PI of the Qatari Birth Cohort study in Qatar, and her main research interest is in gene-environment interactions and molecular epidemiology. The title of her talk is Qatar Biobank, Diabetes Case. Dr. Fthenou, the virtual floor is yours for the presentation. Thank you.
Thank you, Dr. Balázs. Thank you so much. I will share my screen now. I hope you see my screen.
Yes, we can. It's very clearly.
Okay, great. So, hello everyone. I would like to thank the organizer for giving me the opportunity to present Qatar Biobank and our role in precision health. I will give you an example, a tangible example of our role using diabetes case. I'm excited to take you through our journey, share with you our growth strategy, and show some of interesting findings related to diabetes from our population cohort study. So, doesn't come. Okay. So before I start, I have no conflict of interest or commercial bias to declare related to this presentation. So I will start with a brief introduction about biobank industry, and then I will take you through on how Qatar Biobank was designed, our vision and mission, our clinic and lab facilities, the different epidemiological studies that we are running, and I will talk about our impact in precision health initiatives in Qatar, and I will give you a tangible example related to diabetes. So back in 2009, Times Magazine listed biobank as one of the 10 ideas that they can change the world right now. So what is a biobank? A biobank is a biorepository facility used for the systematic collection of and storage of high quality samples and associated data in a structured, analyzable format under an ethical and legal framework. There are different types of biobanks, depending on the type of the sample they store, the aim of the collection they have, or the type of the organization they belong to. So here there are different types of biobanks according to their goal, like research, diagnostic, therapeutic, according to the organization type, academic, in the hospital, pharma companies, or according to the collection that they of the samples they store, like for virus, plant, animal, and human. In this talk, I will concentrate on the human biobanks that, according to the type of the population they recruit, are divided into population-based cohorts, recruited subjects from the general population, disease-based, recruiting patients from specific diseases, and clinical-based, recruiting all patients from the healthcare system. To understand the value of the data through various study designs and the timeline of the study, I tried in this slide to combine the developmental origin of health and diseases concept with precision health and the use of the different study design in molecular and environmental epidemiology. I know it's a busy slide, so please bear with me to take you through it. From a condition of no disease to a disease condition, there are various time windows that the person will pass, and together with the genetic susceptibility that the person carries, then this person will develop or not develop a disease. So we have the birth cohort studies that follow pregnant women and their children after birth, the population cohort studies that follow the general population, and the disease cohort studies that they follow a group of people with a certain medical condition. Now, based on the study design, we collect data and samples that they can be used to identify different biomarkers, such as biomarkers of exposure, genetic susceptibility, prognostic or diagnostic biomarkers. So having these studies would fill the gap of a lifetime data that is a requirement for the generation of meaningful outcomes to improve health. Look how much data is missing from clinical to population-based longitudinal studies. As you may know, there are many clinical-based cohort studies and very few population-based cohort studies, especially in the Middle East. That, according to my knowledge, we're the only one here in Qatar. The Economist published on how science can go wrong, reporting that half of the published research cannot be replicated. Nature survey showed that scientists agree that there is a reproducibility crisis. Replicating a study is an important way to ensure that there is a universal accuracy of a scientific claim. Access to structured, standardized, high-quality data or samples is a way to ensure reproducibility in research. To try to avoid this, Qatar Biobank spends lots of time and effort to develop our quality system. So let me take you through our journey. Let me share with you a little bit about Qatar Biobank. We have been established in 2012, supported by Qatar Foundation, the Ministry of Public Health, and the Imperial College of London. Qatar Biobank is a unique resource in the region. We are a standalone biobank that hosts many studies, and what I mean about That is that we are not under an academia or hospital environment. Our biobank houses our recruitment, the registration team, our clinical and data collection facilities, our laboratories, our medical review team, our research access, and IT resources, all under one roof. Our mission is to act as the National Center for Biological Science and Information to enable research, and our vision is to be a research enterprise platform to deliver personalized healthcare. So here is a graph showing our growth strategy in time, the different initiatives, and the participant number. We started back in 2012, running a pilot study, validating our tools like the questionnaire, clinical assessments, sample collection, processing and storage, as well as our IT infrastructure. Till we reached to ramp up, recruiting 36 participants per day. The initiatives were designed and implemented based on the needs of our researchers and our stakeholders. Data for us is very important. Here are some different standards that we follow, and we are certified for ISO Quality Management System, Information Security Management System, Biobank. We are CAP accredited for human specimens, and we are following ISBER best practices to ensure the quality of our data and our biological samples. So what we do? Qatar Biobank is, we see ourselves as a scientific partnership between the research community and the people in Qatar, that together we can build a healthier future for the generations to come. We systematically collect and store high quality biological samples and annotated data in a structured and analyzable format under an ethical and legal framework. We make these annotated data and the high quality samples accessible for research purposes, and we promote collaboration and synergies between the different stakeholders by removing barriers to collaboration and discovery. And this is how we enable research aiming to precision health. So now I'm going to talk about the different studies that we perform here at Qatar Biobank. So the main cohort studies are the population-based cohort study that we aim to recruit 60,000 participants, adults, Qataris, or people that they live in Qatar for 15 years or more. This is based on an agnostic hypothesis, and the protocols are designed to fit for purpose for the latest sophisticated platforms. In this study, we follow up our participants every 5 years. The second collection is the Qatar Birth Cohort study, aiming to assess the synergetic role of environmental exposure and genetic factors in the development of chronic diseases at early childhood. In this study, we aim to recruit 3,000 trials, the pregnant women, their husbands, and their children in different time points. Also, back in 2020, during COVID-19 outbreak in Qatar, the Qatar Scientific Reference and Research Task Force selected Qatar Biobank to be the key institution to manage and the design and setup of the COVID-19 biorepository, aiming to deliver high-quality samples and data so we can support research around COVID-19. In this study, we recruited participants affected with COVID-19, and we follow them up weekly during their disease period and monthly after recovery for a year. We have also recruited participants before their vaccination against COVID-19, and we follow them up for a year. So let me give you an overview of the visit at Qatar Biobank. Once potential participants come in our building, they are registered with us, and once they are consented, we start the collection of data through different questionnaires and clinical assessments, such as anthropometric measurements, blood pressures, spirometry, ECG, treadmill tests. We are also collecting imaging data such as retina images, 3D ultrasounds, and we assess eligible participants for the MRI visit. We also collect different types of biological samples, such as saliva, urine, and blood. From blood, we are isolating viable cells, serum, plasma, buffy coat, red blood cells, DNA, RNA. We are very proud of our laboratories. They are fully equipped using robotic system for high throughput analysis. So let me give you a hint of the impact of Qatar Biobank on the healthcare system and our role to support precision medicine initiative. And here I will give you also the example about the diabetes case. So Qatar Biobank is empowering precision health at different levels. Precision medicine, precision public health, and precision prevention. In general, biobanks are an asset to support precision health in different levels because they provide deep longitudinal profiling, that they can provide evidence to assess disease risk at an individual level, detect early preclinical conditions, and initiate preventive strategies. So we see ourselves as one of the main pillars in Qatar's precision health because we provide a deep longitudinal phenotypic profiling of our participants, that this can lead to actionable health discoveries and provide relevant information for precision health. The different type of data that we provide is the lifestyle and exposure data, phenotypic data, clinical and medical data, and also we have an omic platform, including genomics, proteomics, transcriptomics, epigenomics, and so on. So let me give you an idea of our population, the prevalence of diabetes in our cohort study. So we refer 54% of our participants back to the healthcare system. You can see from the pizza schema. Remember, these are participants that they consider themselves as healthy. Now pay attention. In the upper side of the slide, the table in the middle. The majority of the referrals were newly identified cases. So at Qatar Biobank, we capture these cases at early stage that actionable healthcare practices can be applied from the healthcare providers to improve the health of our community in future. And this is one of the examples on how Qatar Biobank contributes to precision public health. Now, if you see at the lower stage of the slide, there is another example on how Qatar Biobank contributes to precision prevention. As you can see from the table, the prevalence of diabetes is around 18% in our population. But what it is, Qatar Biobank population. But what it is important is the prevalence of preclinical disease status, identified such as prediabetes, 18.5%. Here, these are people that they are in high risk to develop diabetes in the future. So it is important to mention that our participants, they have been referred back to the healthcare system to follow special prevention programs, including lifestyle modifications such as dietary, to change their dietary habits, physical activities, and so on. So, because we had, this high prevalence of prediabetes cases, we tried to enhance our data, including immunoproteomics. And why immunoproteomics? These are autoantibodies that they are produced in response to alterations in an individual's own protein. They manifest and persist throughout the course of the disease, and they often appear years before the physical symptoms, which offers the potential for early diagnosis, prognosis, response prediction, and disease progression. So this is why Qatar Biobank enhanced deep phenotypic profiling for the detection of autoantibody biomarkers in precision health of diabetes. So this is our study design. So we aim to profile. Our aim was to profile the autoantibodies in pre-diabetic and diabetic participants. Our study included 392 cases, pre-diabetes 195, and diabetic participants 197, and 96 healthy controls. In this presentation, I will focus on the two groups: diabetes against health control and pre-diabetics against health control. So we screen our participants against 1,600 plus antigens. We did an imaging analysis, data pre-processing, and quality controls. And then we have filter for negative controls and PSA filtering. And then we run linear modeling and random forest analysis. So let me share some of the preliminary results. So this is the analysis results between diabetes and healthy controls. As you can see from the figures, we have identified a panel of 10 most discriminatory antigens for diabetics against the health controls. And you can see the clear distribution between diabetic and controls. This is linear modeling, diabetes against controls. Here we have identified 19 antigens with a p-value less than 0.05. Now the other group, pre-diabetes against healthy controls. Again, here in this slide, you can see the 10 most discriminatory antigens for pre-diabetics and healthy controls. And here again, you will see the clear distribution between the two groups in each of these antigens. Pre-diabetics with the same group, pre-diabetics against healthy, linear modeling. Here we identified 8 antigens with p-value less than 0.05. So we compare the top hits using machine learning and linear modeling, and we have identified 3 common antigens using machine learning, 3 common antigens between diabetes and healthy, or pre-diabetics and healthy. And then with linear modeling, again, we have identified 6 common antigens. And also there is 1 common antigen, PRKCB, that was in both analyses identified. Here we see the potential that a biobank can provide for the detection of biomarkers of disease in a population. So let us all agree that data is the new oil, and like oil, needs to be refined, break down into an analyzable format in order to have value. And this is what biobanks they do related to the data that we are collecting. So in this presentation, I hope that I communicated the message and how biobanks add value, not only to the research community, but also how they enhance the healthcare system and what is and how their role is crucial. The preliminary results of immunoproteomics analysis of Qatar Biobank participants with diabetes or pre-diabetes identified potential biomarkers. However, further analysis needs to be conducted by the scientific community to reveal causal inference. At Qatar Biobank, we always try to enhance the deep phenotypic longitudinal profiling of our participants because we know that this can lead to actionable health discoveries. My message is that biobanking services provide fundamental information that are essential for understanding the variations in individual susceptibility to a disease and the response to illness that will lead to support the implementation of precision health. That was my last slide. Thank you so much. You can visit our website. You can register with us in our research platform and view the wealth of data that we can offer you. Thank you.
Thank you very much, Dr. Fthenou, for this exceptional presentation. That was very, very interesting, and we learned a lot, and we can learn also in the future a lot from your experiences actually with this excellent initiative. So because questions are coming in, before I start reading some of these questions, I would like just to make a short comment, because you have a long-standing experience with biobanking in Qatar. It means it started like more than 10 years ago. There's a biobanking also here going on in the United Arab Emirates, the Emirati National Biobanking, and just to mention that actually we have plans to establish a smaller scale local biobank based on our birth cohort study, actually, the Mutaba study, which is a mother-child cohort. So I'm pretty sure that we can learn a lot from your experiences. And I see that we have, meanwhile, we have 2 questions coming in. So let me read the first one. Many thanks for the informative presentation. What are the challenges you faced specifically in terms of machine learning analysis?
In terms of?
Machine learning, using machine learning.
Machine learning, oh, okay. So, so one of the challenges that we face, I have to say, like machine learning is the way that we format our data. So it needs to be in a way like harmonization of the data is a big challenge. The way that this data is going to be transformed for machine learning. In terms now of analysis of the machine learning, I have to say that I didn't do this analysis myself. We have our biostatistician team and our bioinformatics team that they have worked with us. But what like from the data perspective, transforming data, the tools that you need to use are challenging, but we found our way here at Qatar Biobank.
Yeah, thank you very much.
Yes, yeah, it's more information related to the analysis of the machine learning and how we did the analysis. I can provide more information.
Excellent. Thank you. Let's see the next question. Who has access to the biobank? How do you think this will change the diabetes obesity epidemic in the Middle East?
So, one by one. So, access to to our biobank, they have all the researchers inside and outside Qatar. You can visit our website, and then you can register in our research platform. And then you can see our data catalog, the different studies that we have, and the available data that we can provide. Now, how this is going to change? We have different stakeholders. So one is the Ministry of Public Health here in Qatar, that we provide input every, we provide a yearly report. So they have identified the different health challenges here in Qatar through also our population, and different prevention programs and campaigns they've been implemented. We have also, we refer our participants back to the healthcare system where the healthcare providers make sure that they're gonna follow modifications in their lifestyle habits, like dietary habits or physical activity. So these are all measures that they can be as part of the public health or like precision public health programs. And also through campaigns from our communication department. So you can follow us in Twitter, in Instagram, in Facebook. So we always provide messages related to diabetes or other diseases that we have identified here in our population.
Thank you very much. So it means you are open, and that is one of the main functions of biobanks, basically, to be open and share information. Thank you. The next question is, thank you for this very interesting presentation. My question, you have mentioned precision public health. Could you please further explain what is precision public health approach in your cohort study?
In our cohort study, okay, so we have multiple examples. So as I said, early diagnosis it is part of precision public health, referring back to the primary health care centers. Then also we have our wellness report, which is based on the genetic information of our participants, that we provide them back to the participants, which is personalized research outcome. And then we work together with the Ministry of Public Health. We work together with Hamad Medical Corporation, which is the main healthcare provider here in Qatar, to work around biomarkers that we might identify from our cohort study. I think these are some of the examples.
Thank you. And we could see some examples for precision medicine and how the Qatari Biobank fits into precision medicine also. Thank you. The next question is, the incidence of diabetes, obesity in the Arab countries continues to increase at the same time as financial resources are poured into public health initiatives. So where do you think the QBiC, the Qatari Biobank, fits into the public health, into these public health efforts?
The biobank, like globally, it is accepted as a part of a healthcare, I would say, infrastructure if a country wants to deliver precision health for the population. So based on that, it costs a lot, a population-based cohort study. It is lots of effort, but in nowadays, data is value. So I believe that the country that wants to move forward with precision health, delivering to the community, a biobank industry, it is important to be as part of the healthcare system.
Thank you. The next question is, how much of the material are from locals versus expats?
Okay, so here now we have around 70% is or 75% are locals, Qataris, and the rest are long-term residents.
Thank
this
you.
Is, I don't have right now the numbers, but this is about.
Yeah, just the proportions. Yes, thank you. The next common question. Thank you for the interesting presentation.
have 61 different nationalities in our population-based cohort study.
Oh, yes.
So we include everybody, but they have to fulfill the criteria.
Oh, yes. Okay, okay. Very interesting. It's a wide-scale study anyway.
Yeah.
Yes. So let's see the next comment question. Thank you for the interesting presentation. Impressive work. Can you elaborate ongoing or planned studies based on biobank data? One related to environmental exposure, second related to precision medicine.
Okay, so environmental exposures. We are collaborating closely with academic institutions, research institutions, and we're trying to link the environmental exposure data that they are collecting with our data using GIS-based systems. Then we have extensive questionnaires related to the lifestyle, the environmental exposures in terms of using cosmetics, where they live, the type of how many windows they have in their home, the sun exposure, the noise exposure. So we have extensive questionnaires, and now we're trying to enhance environmental epidemiology by collecting data, but this is just at the beginning. At the Qatar Birth Cohort study, we are working with academic institution to develop personal environmental exposure devices, sensors. So we're trying to do all of this. And the second was precision health. I think
related to precision medicine, yes.
Yeah, I already explained how Qatar Biobank contributes to precision health in Qatar.
Yes, thank you. Before going to the next question, I would like to just to make a comment on this environmental exposures, actually, because that's one of the things which interests me as well. And before moving to the UAE a couple of years ago, actually, I've been involved in Europe in some exposome, just very preliminary exposome studies. And you mentioned this term exposome also in your presentation, and which is a very interesting theory, basically. And if I remember correctly, that was related to your to the Qatari Birth Cohort study, where you plan or you're ongoing to investigate exposure, so the exposome versus the genetic factors, so the genome, basically. Measuring or investigating the genome nowadays with these high throughput technologies is quite an established scientific field, and not just genomics, but the other omics, as you mentioned, like metabolomics, transcriptomics, and so on, epigenomics also. But to measure the exposome in contrast to the genome, that's really challenging. And you mentioned collecting information by questionnaires, which is the typical way how epidemiology collects this kind of information. But I would like just to ask you here now whether you have any other ways, yes, in mind or already established, implemented, any other ways to collect information on exposome.
So yeah, one important tool is our questionnaires, because, for example, smoking status is a big part of environmental exposure. Even from food frequency questionnaires, you can identify exposure to acrylamide, which is a DNA adapt. So one is the questionnaire. Second is that we are in collaboration with the academic institutions, the research teams, and right now we have linked our data with air pollution and air pollution, noise, and UV radiation. These are the three. Third, we have all of our biological samples that, depending of the chemical exposure, like short or long term, if they catabolite in a short term or long term, we can do specific analysis. The biological samples that we have, it is during pregnancy at 2 time points, and it is urine, stools. We're going to collect now the stools: urine, saliva, blood with viable cells, plasma, serum, red blood cells also. So we have in our repository the samples that they can be used for certain environmental exposures. And also we are working to develop the personal environmental exposure sensors. That these sensors, they're gonna aim in air pollution, in UV radiation, and we're not sure with the noise, but it might happen.
Just out of my curiosity, actually, so these sensors would be worn on the body of the individuals for dedicated periods of time.
Smartphones, we will not provide like the bag with the pump.
Yes.
So it's trying to be easy for our participants, but we are still at the very beginning of this project.
Yes, these are very complicated issues, actually. Thank you very much. And let's go back to the questions. Luckily, we still have time. So the next question is, you mentioned that this biobank will aid in developing preventative medicine standards and techniques. How do you think it will impact patients who have already been ailed with diabetes, obesity, and other diseases that result from metabolic syndrome such as NAFLD? So those who already have these conditions, basically, how they can benefit.
How they can benefit based on their metabolic profile, an example, or the genomic sensitivity on how they catabolize specific medicines, for example. This is one of the examples, like pharmacogenomics is right now hot in like using data from epidemiological studies. So yeah, we have we have a project with Qatar Genome Program where we provide samples that they can identify biomarkers that they can be used for pharmacogenomics. In general, precision health, a big part is genomics, but metabolomics, for example, or multi-omics analysis, this is the future of precision health. This is at least like my personal belief.
Thank you. Thank you very much. And we have one more questions in the Q&A field. Thank you for the very interesting presentation. My question is, did you take any measures to encourage and increase the participation in the study? For example, incentives for participation?
This is a very important question because without the support of our community, of our participants, a biobank cannot exist. So since you will start now the birth cohort study, for example, or your biobank, it is very important to identify the value proposition of your stakeholders. And one of the main stakeholders are the participants. Like, you have really to listen to them. What what they need. So you're going to provide the incentive that it will motivate them to participate in the study. So one of our incentives is the medical referral back to the healthcare system, and the medical feedback that we provide. So we have our medical review office, where our physicians, they review all of the different diagnostic biomarkers that we are receiving from the diagnostic laboratories, together with the different clinical assessments that we run in our clinics, and they provide the medical feedback back to our participants. And then if we identify that our participants, they have developed or are about to develop a certain disease, we refer either to the primary health care or to back to Hamad Medical system. So this is like a good example on how to attract your participant or potential participants to enroll in the biobank.
Thank you very much. And I don't think we have more questions in the Q&A box. So, and we are approaching to the end of this session. So if there are no more questions, then I would like to close with my closing remarks. So, first of all, I would like to express my gratitude once again to Dr. Fthenou for accepting our invitation and delivering this outstanding presentation. I also want to extend my thanks to everyone involved in making this webinar possible, including the management of our college and the UAE University. Special thanks go to Professor Michael Brivna, Mr. Al-Sajir, Dr. Rifat, Dr. Azar, Mr. Aminu, Ms. Bayan, Ms. Khadija, Mrs. Mariam, and Dr. Saif. I would like to thank our audience for actively participating in the webinar. The link for evaluating the session has been provided in the chat box. Please ensure that you will fill out the evaluation to receive your certificate. Stay updated by following us on our IPH social media accounts at UAU IPH. For access to recordings of all of our hosted webinars, please visit our YouTube channel, Institute of Public Health CMHS. Finally, I would like to draw your attention to our Master in Public Health program. This flexible part-time training lasts for a minimum of 2 years, during which courses are held from Thursday to Sunday in every 2 to 4 weeks through the semesters. For further information, please visit the indicated website or scan the QR code or contact Mr. Ismail on his email. Thank you again for attending our webinar. We look forward to hearing you join us again. Take care, stay safe, and goodbye. Thank you.